for us to share knowledge about prostate health. I'm happy to see that it's not only our men who are here, but I can see our mothers here too. So it means that our mothers will also carry the information across to our daddies who have not been able to come. Praise the Lord. Prostate disease is a disease that has claimed so many lives in our society. It's very common amongst blacks, but it's a disease that most people know less about. So it's very important for people to be educated on this particular disease, so that, especially our men, so that they can prevent it. They will know what to do to prevent themselves from getting it, because it's very common amongst men, especially as they are aging. Of late, unfortunately, it's getting common amongst the young men as well. So please pay attention as I take you through or give you in-depth knowledge about prostate health. So I know most of you, how many of you have heard of prostate disease before? Prostate, oh, that's good. That's good. How many of you know, this question goes to our men. Please, how many of you know where your prostate is located? You have heard about your prostate. Where do you think your prostate can be found? Which part of your body? Yes, Daddy. Please, can you tell us? Where? Urethra. Okay. It's located close to the urethra. That is very good. Very good attempt. So this is how the prostate gland looks like. It's very small. It's about the size of a peanut. It's about the size of a peanut, very small. It's located just beneath the bladder. Please, can you show us the next picture so that I show them where the bladder is? How do I point? I want to show them the bladder. How do I point? Oh, this will be a bit difficult since the screen is far away from me. But the bladder is over there, yes? Let the cursor go up. Yes, that's where the bladder is located. And just beneath the bladder is the prostate. Yes, where he circled. That is the prostate. You see how very small it is. And just in the middle of the prostate, you find urethra. It's a tube that connects from the bladder through the prostate gland, and it comes out through the penis. So when men are urinating, the urine flows out through the bladder. It flows out of the bladder through the urethra, and then it comes out of the penis. So you see that the urethra, where the urine passes, it lies just in the middle of the prostate gland. It lies just in the middle of the prostate gland. So anything that affects the prostate gland affects the passage of urine out of the bladder. It affects the passage of urine out of the bladder. So please take note of this as we go along. Next slide, please. So what does the prostate do in the body of men? Why has God created the prostate gland? So the prostate gland is a smooth muscle, and anytime men have sex and they ejaculate, the prostate contracts. And when it contracts, it gives them pleasure. And apart from giving them like pleasure, it secretes certain secretions into the semen that men ejaculate, the sperm that comes out, about 10 to 30% of the fluid that makes up the sperm comes from the prostate. So the prostate releases these secretions, which mixes with other secretions, comes out as the sperm. And so the prostate, it promotes orgasm. Please, let's continue. These are the diseases that can affect the prostate gland. We have prostatitis, which is simply an inflammation of the prostate. And this can happen as a result of infections, like sexually transmitted infections or ordinary bacteria infections that gets into the urinary tract. So if you're a man who frequently gets urinary tract infections, anytime you go to the hospital, they tell you that you've developed a urinary tract infection. You have to be very careful, because if it is chronic or if it is frequent, it can result in prostate problems later in life. Then we have prostate enlargement, which is commonly known as BPH. BPH is benign prostatic hyperplasia or benign prostatic enlargement. That means that it's non-cancerous. Then we have prostatic calculi. This one is not very common, and it's just formation of stones within the prostate gland. It's not so common. Then we have prostatic cancer. Prostate cancer. I know most of you have heard about prostate cancer. Prostate cancer and prostate enlargement. They are the commonest. They are the commonest diseases of the prostate that we encounter in our society. All right, please, let's continue. So what are the causes of prostate disease? What causes prostate enlargement? What can result in prostate cancer? Old age. This is because as men grow, their prostate continuously grows. It doesn't stop growing. God has created us such that when you grow to a certain stage, almost all the organs in your body, they stop growing, and then they begin to age. So as you age, you realize that the organs are not growing again, they are weakening. That's why the skin, you see it wrinkling as you age. That is a sign of aging. But for the prostate gland, it continuously grows. As men grow, it grows. It doesn't stop growing. And that is why men who are old, they are at risk of getting prostate enlargement, especially those who are in their late 60s and 70s and above. They are at risk. So age is a risk factor. Then we have smoking. Smoking is another cause. Excessive alcohol. Research has shown that men who indulge in drinking alcohol excessively and smoking, they are at risk of getting prostate diseases. Then chronic inflammation. Chronic inflammation, I explained that if you frequently get infections, you are always getting urinary tract infections or any other form of bacterial infection, it's continuously damages your prostate gland. And so you are at risk of getting prostate diseases. And apart from that, obesity, eating of unhealthy foods, like taking in foods that are very high in fat, have also been discovered by research to cause prostate disease. So as you grow, you also have to be cautious about your lifestyle so that you don't eat unhealthy food, and you also try to exercise to be in shape. Okay, so let's look, how common is the prostate diseases that we are discussing today? How common is it? So worldwide, we have about 1,414,259 people who have been diagnosed of prostate cancer alone. Prostate cancer alone. So it's the second most commonly diagnosed cancer in the whole world. So you see why we have to be worried about it. If it is the second most common cancer in the whole world, then we have to know more about it. We have to take good care of ourselves so that our men, especially our men, women don't have prostate, so we are not worried, but our fathers, we care about you. And according to research, black men are more likely to get prostate than white men. It's common amongst blacks. So you find a little percentage of white men getting prostate enlargement, but it's very common amongst blacks. And let's look at our society, that is Ghana, our country, Ghana. How common is prostate disease in Ghana? As at 2007, Kolebu Teaching Hospital did a research, and out of every 100,000 men, they recorded 170 men had prostate cancer. 170 men out of 100,000 men had prostate cancer. And another research done in 2010 revealed that 750 men out of 1,000 men who had prostate cancer died. So it means that if 1,000 men have been diagnosed of prostate cancer, there's a 75% probability that out of those, that number, about 75% of them will die. So you see how bad it is. Out of 1,000 men diagnosed of prostate cancer, 750 died. Only 250 survived. So early detection is very important. And you can only detect it early when you have knowledge about it, when you know what is happening to you, so that you can report early. And it's estimated that 8 out of 10 Ghanaian men are diagnosed with prostate-related conditions in their lifetime. This is research recently done, has proven that 8 out of 10 Ghanaian men are diagnosed with prostate-related diseases. So you see how common it is. If 8, you take 10 men, and out of the 10 men that you take, 8 of them are likely to have prostate problems. So what we are going to discuss today, what we will concentrate on, is benign prostate hyperplasia, which is a non-cancerous enlargement of the prostate. So BPH and prostate cancer are two different things. It's not the same. When you hear of prostate cancer and BP or prostate enlargement, they are two different things. Prostate cancer is a cancer, and I know that you all know what cancer is. When they say something is cancerous, it means that it is deadly and it can spread to the rest of the body. But with BPH, which is just an enlargement of the prostate, it's non-cancerous. It doesn't spread to the rest of the body. However, it has got some deleterious effects on the body, which we will take a look at later. So prostate enlargement frequently occurs in men, and majority of men, as they progress in life, I talked about age as one of the causes of prostate enlargement. So as men progress, as they grow, then their prostate also begins to get enlarged, or it grows. And the prevalence of BPH is about 62% in men who are over 50 years of age. So about 65% of men. And in Africa, about 50% of adult males who are 60 years and above develop prostate enlargement. About 50% of men who are 60 years and above develop prostate enlargement. Okay, so let's look at our settings. Ghana. In Ghana, how common is it? So in Ghana, between the ages of 40 and 70, about 64% of our men have developed prostate enlargement. And 50 to 60% occurs among people who are, or amongst men who are 60 years old. And 80 to 90% occurs amongst men who are 70 years and above. So here too, you can see that age is an enemy. So as our men grow, even though age is good, as they are growing old, they are at risk of developing prostate enlargement. If you have prostate enlargement, how would you know? What will you experience in order, or what will you see to be able to know that, oh, I have prostate enlargement or not? So symptoms, what will you see? You will feel the need to urinate often at night. So if you are urinating at night more than often, you should know that something is not right. Even though there are other causes of urinating frequently at night. For instance, diabetes can also make you urinate frequently at night. So if you don't have diabetes and you start urinating frequently at night, then you have to go to the hospital for lab tests so that they will be able to tell whether it's diabetes or it is the prostate that has started getting enlarged. Then you can also have difficulty starting urination or difficulty with passing urine. When I started, I showed you the anatomy of the prostate gland, or how the prostate gland looks like. The second picture I showed you, you saw where the prostate gland is located, just below the bladder. And I showed you a tube that passes through the prostate gland. I also explained that as the prostate gland enlarges, it compresses on the tube that lies in the middle of it. And because it compresses on the tube where urine passes through, it makes it difficult for you to, or for the man to pass urine when it gets enlarged. So there's difficulty with urination. And also men experience urgency. Urgency means that when they feel like urinating and they don't hurry up, they may wee-wee on themselves. So unfortunately, some of our men, when they develop this problem, they can't go out. Because when they are sitting in a car and they feel like urinating, it's so pressing, or they feel like if they don't urinate immediately, they may urinate on themselves. So they have to stop the car. And sometimes before they even get to where they have to urinate, they wee-wee on themselves. So they are always stinking or smelling of urine. So it's not a good condition at all. It also slows down the flow of urine. So if you are a man and then the speed with which your urine flows begins to slow down, then you have to worry. Because when you are urinating, you know the normal speed with which your urine flows. It comes out with speed. And then all of a sudden, it begins to slow down. You see that the speed is very weak. It's coming down slowly. Not like it used to be. Then you begin to dribble. That means that you go and urinate and finish urinating. You want to dress up, and then some of the urine is still coming. So you have to wait till everything drops. You think that everything has come out, then you want to dress up. The urine is coming again. It's dribbling. They also have a sensation that the bladder is not fully emptied. As I explained, that as the prostate gland becomes very big, it compresses on the urethra. So the bladder, the urine is not able to flow out of the bladder. It's not able to come out. All the urine doesn't come out of the bladder. So some of the urine still stays inside the bladder. And when it happens like that, you go and urinate and only small quantity of the urine in the bladder comes out. The rest still stays in the bladder. So you feel like you've gone to urinate all right, but you still feel like you are not okay. You still want to urinate, but the urine is not coming out. You feel like your bladder is still full. Because when you have the urge to urinate and you go and urinate, after urinating, you have this feeling of relief. You are relieved. But in this case, because there is an obstruction, you go and urinate and only a small quantity comes out. So you still have that urge. You are still not satisfied. You still feel like you still have to go and urinate. Then they have burning sensation when they are going to urinate. It's very painful. Sometimes they feel burns, even though there's no infection, but they feel that place is burning and it's painful. And gradually, they develop erectile dysfunction. Erectile dysfunction is when they are not able to perform well on bed. So you begin to develop sexual weakness. Because, as I explained to you, that the prostate plays a key role in sex. From the beginning, I explained the function of the prostate gland, that it plays a key role in sex. So if your prostate gland is diseased, then you begin to have problems with sex. So that is when our elderly men begin to, when they start experiencing sexual weakness, then they attribute it to age. Oh, I'm growing old, so don't worry, it's because of age. But there are men in their 80s who still have two who still are performing very well. So if you are 60 years and you have sexual weakness, age is not an excuse. Maybe you might have a disease. There may be an underlying problem which has contributed to the sexual weakness, and the prostate should not be ruled out. So what are the consequences if you have a prostate problem and you don't detect it early? You have started experiencing all these symptoms that I talked about, and you haven't reported to the hospital for early treatment to be initiated. What can happen to you? What are the consequences? A time will come when your urine will stop flowing completely. So if now some is coming out, at least it comes out, some flows out, but you feel like some is still left. It's you have the feeling of incomplete emptying, and you don't do anything about it. What can happen to you? A time will come, they have to pass a tube into your penis for it to empty your urine. So you'll be walking with this tube around for the rest of your life. You go to the hospital, they will take out the tube, but they have to pass another one because the prostate has become so big that it has compressed on the urethra that I showed you, that nothing can be done about it unless they pass a tube into your penis, and which is very painful. And you have to go for them to be changing this tube all the time. Sometimes they have to send you to theater, pass metallic objects into your penis in order to open the pathway of the urethra, which is a very painful procedure. So nobody has to sit down until you get to that stage. You don't wait until you get to that stage. Then you can also begin to pass out bloody urine because of bladder wall damage. The bladder is not supposed to keep too much urine. So if it's containing or taking too much urine, a time will come when the wall begins to get damaged. And when the wall begins to get damaged, you start passing out bloody urine. You can also begin to develop urinary tract infections because your urine is not flowing well. And as your urine stays in your bladder for a long time, it makes it very easy for infections or organisms to multiply. So always you are getting infections in your urinary tract. And with time, your kidney suffers. You get kidney problem. And you know that when you get kidney problem, it's terrible. When your kidney fails, that means that you need either dialysis for the rest of your life, or you need to go through renal transplant or kidney transplant, which is a very expensive procedure or surgery. So these are the consequences of prostate enlargement. It can also lead to erectile dysfunction. That means that you can't perform well, you can't satisfy your wife on bed, you can't even perform at all. And it can lead to incontinence. Sometimes you just be there and your urine will just be flowing out. It will be coming out, you'll be urinating on yourself. As a man, wherever you go, you smell of urine, so you can't go out. So this doesn't look good at all. What effects does it have on men who have this problem? It's very uncomfortable, it's inconvenient, and it's very embarrassing. Just imagine you come to church and you go to urinate, you come back and you are smelling of urine. And you come and sit, and you yourself, you don't feel good. Because everyone around you can smell you, like they can smell the urine on you. So it's a very unpleasant condition. However, there are treatment modalities. So if you have prostate enlargement, it doesn't mean that there is no hope for you. There is treatment. And so early detection, they say, saves lives. There are drugs that we use in the treatment of this condition. So when you go to the hospital, you can get drugs. You'll be given drugs. There's also surgery that can be done for you. And surgery is the most, is the only solution for now. That is what is often done. Then recently, a transurethral resection, that means that they go through the urethra to bring out the prostate, to remove the prostate. And they will also remove your testes for you. Unfortunately, when your testes is taken out, you cannot perform, or you can't impregnate a woman for the rest of your life. However, there's also natural remedy which has been proven safe to shrink the enlarged prostate. So we have natural products as well, which when you take early, that is when you have the mild to moderate disease, you don't sit down and wait for the condition to get very complicated. At the early stages or at the initial stages, natural treatment has been proven to also help, or alternative treatments are also there that can help take care of this condition or treat it. Okay, so let's go to prevention. So how do you prevent BPH or prostate enlargement? Research has shown that when you eat foods, that's vegetables, fruits and vegetables, especially fruits and vegetables that has got red, that looks red, like tomatoes, red grapes, watermelon, any fruit and vegetable that looks red, because it contains an ingredient called lycopene. And that lycopene helps to prevent prostate cancer and prostate enlargement. So any red vegetable or fruit helps to prevent prostate enlargement. And for men who drink alcohol and they smoke a lot, they also have to stop smoking and drinking. And you have to make time for exercise. And if you are obese, you try to lose weight. If you have diabetes and hypertension, you also have to take very good care of yourself to keep your BP and to keep your blood pressure well regulated. That means that in a normal state, your blood sugar should always also be normal. And you also have to reduce the frequency of sex. Men who have excessive sex have been proven by research to have the risk of developing prostate enlargement. So if you're a man and 4 or 5 times a week, you are always active and you think that you are strong, please be careful, because you can develop prostate enlargement. And you should also know that if you don't have enough sex, it's also a risk factor. So men who don't also have enough sex, that means that the so so too much of everything is bad, but that doesn't mean that you shouldn't do it. You should do it, but it shouldn't be too much. And there are some men for 3 to 6 months, they don't have sex, or some about a year, they don't have sex at all, and they are not bothered. That is also not good. If I say enough sex, at least twice a week is fine. But there are some men almost every day they are at it, and they are happy they are at it. Please, too much of it is also not good. Regular check-ups. What was the last time you went for checkup? What was the last time you went to the hospital and asked that you want to check or conduct tests on your prostate as a man? Has anyone here done that this year? This year, last year, December. Well done. You've done well. Any other person? Okay, good. So as a man, you have to make a conscious effort that every year you have to go to the hospital to check your prostate gland. Just as women we are being encouraged to check every year, or even the best is every 6 months, to go and check their breasts for lumps, for breast cancer. Men are also expected to go to the hospital for checkup, so that if you develop prostate enlargement, it can be picked up on time. Because there are some drugs that you can take that can shrink the prostate. Because when it gets big or it enlarges up to a certain point, the only solution is surgery. And even sometimes surgery alone is not enough to help remedy the problem. And if it's prostate cancer that you have developed and it's not detected early, it can spread to all the organs in your body. And once it spreads to all the organs in your body, your rate or your chances of survival becomes very low. Your rate of survival or chances becomes very low. And that is why out of 1,000 men who were diagnosed of prostate cancer, about 750 of them died because they reported late. So if you have heard this by the grace of God, I know that I didn't just come here for nothing, but maybe it's a knocking on your hearts and on your door, on your conscience as well, that as men, you should do well to take good care of yourself. It's good to have faith that God is protecting you, God is taking care of you, and no harm will come close to you. But it's also good to take good care of yourself, because it's our bodies that we live with. And so it's good to take care of this body that God has given to us. Thank you very much for your audience. At this point, I would like to take questions from you.
Two questions?
Doc, I want to find out, how do you determine your prostate has enlarged?
Okay. So when you come to the hospital, first of all, we do take your history. We listen to your complaints that you tell us. And after that, we carry out an examination on you, which is a digital rectal examination. So we will put our finger into your rectum or your anus to feel your prostate gland. If we feel that your prostate is enlarged, we will let you go for tests. We'll let you do prostate-specific antigen tests and also for an ultrasound scan to be done or carried out on your prostate. And if it's enlarged, the scan results tells us that your prostate is enlarged, your PSA is high, then quickly we put you on treatment to bring it under control. Are you okay?
You are all right, or you still have to for the enlargement, all that you have said, you have just mentioned.
Yes, even with a low PSA, you need to do the scan. If you do the scan and the scan is normal, you do PSA is normal, then you are fine. But if you don't, sometimes you may have a normal PSA, but the scan will show that the prostate has started and getting enlarged. Do you understand? So the prostate can start getting enlarged and the PSA might still be normal. So you shouldn't be deceived by the PSA. The PSA alone is not the golden standard for diagnosis. It doesn't mean that if PSA is normal, everything is fine. You need to do a scan of the prostate gland as well.
So is there a case where you may go through all these processes and you still find out that, the symptoms are just, around you? I mean, you are feeling the symptoms, but you have gone through all these processes and still, I don't know.
I understand what your question. It means that you have done the scan. The scan is normal. You've done PSA, it's fine. Doctor has examined, your prostate is not enlarged, but you are still experiencing the symptoms. Sometimes it might not be prostate enlargement. Sometimes it might be chronic prostatitis. I mentioned a particular condition of the prostate, which I said that is as a result of infection or inflammation of the prostate. So if that infection is there, you might experience all these symptoms that I've talked about because it also makes the prostate enlarged. It makes the prostate like it gets swollen. And that enlargement cannot be compared to the enlargement of the BPH, even though it's enlarged, but it's not like the BPH. So you might also get the symptoms of BPH. So I think that what can also be done for you is for them to test for infections and see if you have any infection of the prostate gland. Then it can be treated. But the best solution for every man here is prevention. Prevention is better than cure. And when you detect early symptoms, you can get something on prostate enlargement, start to take it as preventive. Something like some of the natural remedies, which has also been proven by research to help shrink or reduce the prostate to normal size, you can take it. Thank you. You're welcome.
Thank you for your talk, Doc. Just a quick question. You mentioned earlier that prostate was more common amongst black men than white men. Is there any particular reason? Is it the male anatomy or the black male anatomy, or I'm trying to understand why it's a peculiar case with black men and not with white men?
Okay, so it has to do with genetics. It has to do with genetics, and that is the explanation that has been given so far, that the genes of the blacks makes them more, or it predisposes them to getting BPH than the whites. Yeah.
My question, you mentioned that there are recently more cases with the youth now, even though it is generally believed to be a disease for older people. So I'm asking, as a young man, at what age do you recommend that we should have our prostate checked? Is there a safe age bracket where we shouldn't be worried about checking our prostate? And in your experience, with young people you have handled, what were some of the things that caused them to have such a disease at that age?
Okay, so initially we thought that it's common amongst people or men who are 40 years and above. But then recently we discovered that even as early as 35, some few, but that percentage is very little. You find a few men coming at the age of 35, between 35 and 40, with prostate enlargement, which is very early. And another risk factor is family history. Sometimes it might be in the family. So if your father or your grandfather ever had prostate enlargement, you also have to take good care of yourself, because it means that there is that genetic predisposition. There is something in your genes that makes, or if you inherit those genes, then you also stand a chance of getting the prostate enlargement if care is not taken. Yeah.
Thank you very much, Doc. You made mention of natural remedies. Is that the food, types of vegetables that you spoke about, or there's other natural remedies that we need to be aware of?
Okay, so I spoke about the food, the fruits and vegetables, and avoiding eating like fatty foods that are high in fat, especially animal fats, the intestines of animals, goat meat that has got a lot of fat on it, turkey, and so many other meats, and what's it called, sausages, and all those foods. It predisposes you to prostate enlargement. But then there are certain natural herbs like saw palmetto and beta-sitosterol. They are natural remedies. Unfortunately, they are not found in our society. Here, you don't find saw palmetto, just like the way we have our prekese and other things. You don't find it here. It's common in India, China, and other places. And I think that Mr. Latif here is coming to talk about a product that contains all those ingredients, which can also help you very well. Thank you very much. Please, is there any other question for me?
Yeah. Doc.
Yeah.
Doc, you said if you have frequent sex, you're at risk. And if you don't have to, I want to find out if there has been any research to help people why Catholic priests don't have this problem. I think it will help if they are not having sex and they are not having it. Is there any research into their situation that can help people?
I don't think a research has been carried out on Catholic priests, but a research has been carried out to prove that excessive sex, especially men who have multiple wives, they have been proven to have a high risk of developing it. But I haven't seen any research carried out on Catholic priests yet.
Doc, can I help you?
Yeah.
There was one that was done on Catholic priests in Brazil.
In Brazil?
It has proven
that
it is one of the diseases that affects Catholic priests the most.
Okay.
Because of their celibacy issue.
Okay, thank you very much. I'll go and read about it.
Yeah, please. So maybe last, my question is, Doc, if you can recommend some hospitals that men can go to if they suspect that they are experiencing symptoms, yeah.
Oh, you can go to any hospital around, any district hospital, regional hospital. As for Kwelebu, you don't have to go there. But even the Rage Hospital, Medina, all those hospitals around, they do carry out tests on prostate. So it's not a big deal at all.
Yes, thank you. Please, my question is focused on the young ones.
Okay.
So So in the case of bedwetting,
Okay.
I mean, I'm aware that the males, the gender male, at a younger age are more like twice likely to, have that tendency of bedwetting. Sometimes at the age of 5, sometimes most of them stop. But then with the males, they go a bit, some of them go a bit further, so like 15 and the rest. For a parent, as a parent, is it something that you should be alarmed about with all that you've said about the effect it has with the bedwetting and that? I don't know if you get my question.
This bedwetting, or we said they have nocts, like urinating frequently at night, but they don't bedwet. Adults don't bedwet. They get up and then they go to urinate. It's just that the number of times they have to wake up to go and urinate is too much. But for kids, that is a different condition or problem in kids or, adolescents, in children or adolescents. And it can be treated. They need psychotherapy. They also need medical treatments. So it can be treated. Yeah.
Thank you so much.
You're welcome.
When it is getting more interesting, we have to come to an end. But Doc, we are very grateful for coming.
You're welcome. Thank you very much.
Insight into it, and it is so much. So we have all taken some lessons, and we know the men. Let's protect ourselves so that as we live longer, we can serve our Maker the more. Thank you so much once again. Latif, we have some 1 minute just to introduce the product. Then we start our normal.
Yes, please. I think when Doug was speaking, she mentioned that the natural remedy has really helped in solving this particular problem. And then there's a company called True Wealth Healthcare has bought a product to help you shrink your prostate and help you to be able to manage your urination that you have a challenge with. And then maybe you don't have affection for sex and those sort of things. You have sexual erectile dysfunction. You can have these medicines that can help you. They are natural products from India. And we know that India is one of the most potent company that does natural product that help people to be able to come out from the various diseases. It's called Prostate. And it contains the ginkgo biloba that you mentioned, the saw palmetto, those ones that can help you to be able to solve your problem that's supposed to be. So please, we are encouraging you. There's some at the back, right at the entrance there. Because of time, I can't speak much about it, but if you take this particular one, it can help you shrink your prostate and help you. If you have difficulty in urination, it can help you. If you have double urination, it can also help you as well. And it'll be able to help you open up your urethra for you to be able to have the urination that comes through properly. So please, if you have that challenge that we have here, outside there, there is 120 Ghana cedis. You take one morning, one evening, and it can be able to help you solve your problem. Thank you very much, and God bless us all.